Chest tube, as we said previously, we can use chest tube to treat pneumothorax, hemothorax, and to remove the accumulated air, blood, fluid in the pleural space in the chest cavity to re-establish the negative pressure inside the chest, so that to treat the lung collapse and to help keep or hold the lung open, and in order to draw the blood from the atmospheric to inside the pressure. In this chest tube, there is a tube from the patient here in which the blood accumulated. Additional chamber to collect the fluid drainage. If the first one is filled, we can move to the next and to the third one. In the additional column there is a water seal chamber, okay, from the manufacturer. من المصنع بتكون هيك. And there is a filtered this chamber to help remove air from the pleural space, but not to exceed ناقص 20 mm mercury, and the suction attached to the wall suction ما يزيد هذا البريشر عن ناقص 20، بنسميها suction control chamber. Filtered room air is drawn into the suction control chamber to ensure that the amount of suction does not exceed 20 mm mercury. So that in the first chamber, as we said, the blood fluid drain from the patient drain to this first three chambers. The air evacuated from the patient to pleural space. Air drawn from room to maintain added suction at 20 centimeter أو 20 mm mercury. The water طبعا should be sterile. The type of chest drainage: traditional water seal, which is called wet suction, تحتوي على collection chamber, suction, and water chamber. Sterile water installed into water seal and suction chamber. Water act as a seal and keep the air from being back to patient. طبعا هذا الماء الستريل ووتر اللي موجود داخل هاي الشامبر بيعمل as a seal اغلاق بحيث يمنع اعادة الهواء الى المريض. Positive negative pressure release valve، وهذا الفالف بيمنع ايضا بيساعد بعدم اعادة الهواء او accumulated blood toward the patient. Suction ممكن يكون موصل طبعا زي ما حكينا. The degree of suction is determined by amount of water in the suction control chamber، واللي هو عبارة عن 20 سنتيمتر كما هو موضح في السلايد اللي قبليها. في عنا dry suction water seal يحتوي على collection chamber, water and suction chamber. Sterile water installed into water seal chamber up to 20 centimeter has positive negative pressure release valve. Suction pressure is set with regulator. هو الفرق ما بينه وما بين اللي قبله الووتر سيل chamber انه quieter صوته اهدى. Dry suction has a one-way mechanical valve that allow the air to leave the chest and prevent air from moving back into the chest. No need to fill the suction with chamber with water, using only in emergency. ويعمل حتى if in knocked and during patient ambulation. حتى لو انتنى التيوب بيشتغل وبكون شغال واموره تمام. The equipment: chest tube insertion tray, chest tube, scalpel, gloves, antiseptic solution, local anesthetic agent, chest drainage system, adhesive tab. These equipment are necessary to insert the chest tube inside the pleural space. You can watch different video on YouTube. اكتبوا فقط chest tube insertion على اليوتيوب، فقط اكتبوا chest tube insertion واحضروا الفيديو. clear فقط اكتبوا chest tube insertion. Some actions are needed or nursing consideration. Be sure that the tube does not neck, loop or interfere with the patient movement. Provide adequate analgesia لأنه painful procedure even after the insertion. Change position for the patient Q2 hours. gently milk the tube into the direction of the drainage system. يعني هذا التيوب اللي نازل من صدر المريض باتجاه الأرض باتجاه الchest bottle باتجاه الchest drainage system. نعمل عملية ملكينج خفيفة بحيث انه ننزل الدم او الفلويد accumulated بالتيوب، بس شوي شوي، ما نحاول نشد التيوب كثير اللي يطلع من صدر المريض. Make sure there is a fluctuation in the fluid level in water seal chamber. وهذا ال fluctuation انه مستوى الووتر in the water chamber بيرتفع بالانسبيريشن وبنخفض مع الاكسبيريشن. غياب الفلكتويشن هذا قد يشير الى انه lung expansion، اللنج رجعت امورها تمام وسليمه وبطل يصير في عنا air و blood drawn toward the chambers. tube obstruction، سكر التيوب بالتالي بطل يصير في عمليه drainage. the suction system not working. encourage patient to take deep breathing and coughing at regular intervals. إذا lung expansion طبعا الأمور تمام. tube obstruction بنحاول نزيل هذا الأوبستراكشن. suction not working بنحاول نصلح جهاز السكشن. The drainage system should be always under patient level، دائما تحت مستوى، لأنه إذا رفعنا chest bottle above the patient the blood will go back from the chest bottle toward the patient chest. Do not use clamping during disconnection of the drainage system. طب شو نعمل إذا صار في disconnection؟ You have to go back to read if you transfer patient, some error, there is a disconnection, what you can do in case of chest tube disconnection. This is a question for you. During removal, the chest tube is clamped, then removed, apply 4x4 gauze during removal. Monitor the color, amount, consistency of the fluid that is drained from the chest toward the bottle. لازم نراقب شو السائل اللي بيطلع من الchest، كميته، لونه. Keep suction at prescribed level. Keep air vent is open when suction is off. Monitor O2 sat, vital signs, breathing sound, surgical dressing, ECG, skin color, and capillary refill.